This is Syrebo E12 hand rehabilitation device, and you can see this is from the company Biotronix here international, and you can see this is the host device. This is the rehabilitation glove. This is the data glove. This is a wireless data glove, and these are the carry box and all. This is the manual, and these are the charger and accessories. So today I am going to give you the demo of the device. This is the E12 model, the latest advanced model, which is having 6 modes, 6 training modes. While other models in the market is having only 3 training modes, it is having 6 training mode with the wireless data glove, while the other models are having the wired data glove. So now I am going to show you the demo of the same, and for that I have already switched on the machine. I am switching it off. You have to just long press that key to switch on. The device had got switched on, and you can see there are 6 training modes in the same. This is the timing display, and these are the 6 training modes. Let me repeat the same: passive mode, mirror training mode, fine motor training mode, opposition, pinch, stretching mode. The device is also having the voice broadcast feature, so everything you're going to do with the device, it will broadcast you whatever is happening. It will voice broadcast the same. You can switch off the same, or doctor can switch on the same, and the doctor and patient will get to know that what is happening and what is the going on in the same mode. So now I'm showing you the training mode one by one. So in the passive training mode, your rehabilitation device will extend and flex, and in the passive mode, the patient will wear that rehabilitation glove, and the hand will flex and extend in the passive training mode. And now I'm showing you how it will happen. I just start the same. As you can see, the rehabilitation glove. Extension, hand is getting extended. Flexion, it's getting flexed. So you can also adjust the time of the flexion and extension using this control. Like from 1 to 9, I can from 1 to 9 seconds, I can adjust the flexion time as well as extension time. You have to use this button to increase or decrease the time. Like I have put the same as 9 seconds and 7 seconds as extension. So you can vary the extension time and flexion time from 1 to 9 seconds according to your need. So the device remain in the same state for that period of time, then it will perform the other action. Also in this device, while other device not having the option for the same, you can also adjust the power of the same. You have to just press this button. You will go to the intensity adjustment, power adjustment, where you can also adjust from 1 to 9. 1, 2, 3, 4. This is the power, the air pressure in Pascal pressure, by which your hand will get contract and relax. So you can adjust the power from 1 to 9, and power or extension to from 1 to 9. 8, 9, 1, 2, 3. So in passive training mode, your hand will extend and flex, and you can adjust the power as well as the extension and flexion time from 1 to 9. While other models don't have the option for the power adjustment or intensity adjustment. So this is the passive training mode, and now I am showing you the second mode, training mode. I just pause the same, go to the mirror mode. I just switch to the mirror mode. In the mirror training mode, the rehabilitation gloves, this is the rehabilitation gloves, and this is the data glove. This is the wireless data glove. So whatever I will perform in that data glove, whether the doctor will perform or the patient with the normal hand will perform the same, will be repeated in that rehabilitation glove. So this is the mirror copy of the same. Whatever be happening over here will be happening over here also. So the same can be used for also the ADL training, like carrying this ball and all. So I am showing you the demo of the same. I just wear the same in my hand, and now I have to press the start key. I just started the mode. I'm opening my hand. So you can see I just close my hand, and the rehabilitation glove also get closed. I open the same. So you can see I just close the same again. So everything I am performing over here, it's getting repeated in the rehabilitation glove. So the patient with the normal hand will wear the same, and the affected hand he will wear the same, and the action he will perform in the rehabilitation data glove will be copied in the rehabilitation glove. So a motor connection will build up in the brain, and it will help in rehabilitation. So this is the wireless data glove. You just don't need any wire in the same. While other models are having the wired in the same, you have to plug in the same, but it is the wireless, so you can use the same. Now I am telling you the third mode. Switching the same to the fine motor mode. Just starting the same. So you can see what I have started the fine motor mode, and you can see your thumb is getting now next finger will get flexed. It will now get extended. Now the next finger will go flexion. So one by one each finger and thumb will go in the flexion and extension. So this is the fine motor training now. So now I am switching off. Now I am pausing the same and switching to the fourth training mode, that is opposition training mode. So you can see the difference between the same. The pinch is formed between the thumb and the first finger. Now the extension same will be open now, and now the pinch will be formed between first thumb and the second finger. So you can see one by one pinch is formed between all the fingers and thumb, and this is the opposition mode. The opposite thumb form the pinch with the opposite fingers. So now the second last training mode is pinch training mode. Now you can see what is happening in the pinch training mode. I'm just going to press the start key, just starting the same, and you can see the rehabilitation now. So now first the hand, pinch is formed between the thumb and the first finger. Hand is getting open now. Everything the device is performing, it's giving you the voice broadcasting. So the pinch is formed between these two fingers and the hand. Now it will have open the same again. Now next the pinch will be formed between these three fingers and the thumb. Now all the four fingers will form the pinch with the thumb. So this is the pinch training mode, where you pinch is formed between first fingers, then first and second, then first, second, third, and then first, second, third, fourth with the thumb. So this was the fifth training mode, and I'm just pausing the same too. And the last training mode is the stretching training mode. When all the training has been done, the last training mode is the stretching training one. After all the exercise, you have to just stretch the hand. So this is a training mode for the same, and I'm just starting the same. This is a stretching training mode, where your hand will go into the stretching mode, and it will get stretched for a while, and after that it will relax. The rehabilitation gloves has the four size, like small, medium, large, and XL. So according to the patient hand size and all, the respective hand rehabilitation gloves can be used. Currently the patient hand is little bit smaller than the rehabilitation glove we have, so that is why the same is getting open while performing the action. So for that patient, the size of the glove will be medium or large. So if you put the large or medium glove over here, the same will be not opening the in the extension and flexion. So this is the stretching mode, and these were the 6 training modes I have already shown. And this is the wired data glove, and the same can also be controlled and used from an app. The app can be downloaded from the Syrebo website for E12 model, and that app you can perform all these tasks from using the app button. And also in the app you will having the option for the gaming purpose. So when patient play a game and perform the activity according to the set things, the motor connection build up patient with the brain and everything, and patient rehabilitation will be achieved much faster than the normal passive training mode. So you can see I have already installed the app in the phone. So just log in the same. You have to create a login in the same, and after logging in the same, you can see this interface of the app. So this is the training mode, this is the gaming mode, and this is the record. So in the training mode, you can perform all this activity you have done over here through this app. So you can select any of the training mode, like passive mode is selected, pinch mode is selecting. You can increase or decrease intensity from here. You can increase or decrease flexion or extension time from here, and this is the remaining time of the training. So when you start the same, you can see the device is also working, rehabilitation glove is also working, and you can switch off the same too. So now I am exiting the training mode, and this is the gaming mode. You can see a game is there for the patient. For using that game, you have to wear that glove in the hand, and then patient can perform the activity according to the need, and rehabilitation activity will be repeated in the same. So by this you can play the game also, and that will help in the rehabilitation to get more faster and easier. And these are the 6 training mode I have already shown to you. Thanks for watching.